What could possibly lead a pregnant woman to experience severe abdominal pain and heavy bleeding? Any guesses? Picture yourself in a world where the excitement of expecting a new life is sometimes marred by unexpected complications. One such complication is a condition that can be as mysterious as it is dangerous. It's a whirlwind of emotions and challenges, a journey of understanding, of curiosity, and of discovery. So brace yourself for an enlightening exploration. Well, if you guessed abruptio placenta, you're absolutely right. Abruptio placenta, an intimidating term, right? But let's break it down. Picture it like this. Imagine you're a tenant in an apartment. Everything is going great, you're comfortable, and you've got everything you need. Then, out of the blue, the landlord decides to evict you without warning. That is, in the simplest terms, what happens with abruptio placenta. This medical condition is a serious pregnancy complication where the placenta, the baby's lifeline, providing all the necessary nutrients and oxygen, prematurely detaches from the uterus. It's like the landlord suddenly breaking your lease when you're not prepared to move. This detachment can be either partial or complete. A partial detachment is like being told you have to move out, but you are still allowed to stay in a portion of the apartment. It's not ideal, but it's manageable. A complete detachment, on the other hand, is like being told you have to vacate the entire apartment immediately. It's a dire situation that requires immediate action. Now, why does this happen? Well, just like with real-life evictions, the reasons can vary. It could be due to trauma or injury, such as a car accident or a fall. It could also be due to conditions like high blood pressure, smoking, or using illegal drugs during pregnancy. Or it could just happen without any clear reason, just like how sometimes life throws curveballs at us. The effects of abruptio placenta can be severe. For the baby, it can lead to premature birth, low birth weight, or in worst-case scenarios, stillbirth. For the mother, it can lead to shock, blood clotting disorders, or even life-threatening bleeding. It's a serious complication that underscores the importance of regular prenatal care and maintaining a healthy lifestyle during pregnancy. So in essence, abruptio placenta is like an unexpected eviction notice for the baby. It's a sudden, often shocking event that can have serious consequences. But with timely intervention and proper medical care, both mother and baby can weather this storm and come out on the other side healthy and strong. Now that we know what abruptio placenta is, let's dive into some key points. Abruptio placenta, or placental abruption, doesn't just happen out of the blue. It's often the result of certain conditions or habits that increase the risk. The primary culprits? Trauma, hypertension, and smoking. First, let's talk about trauma. This could be anything from a car accident to a fall. In fact, any event that impacts the abdomen can potentially lead to abruptio placenta. It's a stark reminder of how important it is to keep the belly safe and secure, especially in the later stages of pregnancy. Next up, hypertension. This is high blood pressure, and it's a major risk factor. The stress of high blood pressure can cause the placenta to separate from the uterine wall, leading to this condition. It's a common issue among pregnant women, especially those with pre-existing conditions or a history of preeclampsia. And finally, we have smoking. This is a big one. Not only does smoking increase the risk of abruptio placenta, but it also has a whole host of other negative impacts on pregnancy. Smoking can restrict the oxygen supply to the fetus, which can cause growth problems and increase the risk of premature birth. It's also worth noting that abruptio placenta usually occurs in the third trimester. That's the final stretch of pregnancy, when the baby is growing rapidly and the body is preparing for birth. So, it's a time when the body is under a lot of stress, and any additional strain can potentially lead to complications. So there you have it. Trauma, hypertension, and smoking. These are the key factors that can increase the risk of abruptio placenta. It's not about scaring you or making you paranoid. It's about understanding the risks and taking steps to minimize them. Because knowledge is power, and the more you know, the better prepared you can be. So it's not something that just happens. Certain conditions and habits can increase the risk. Are you still with me? Great, because we've got more important points to cover. Let's delve into the symptoms of abruptio placenta, which primarily include abdominal pain, vaginal bleeding, and rapid contractions. Abdominal pain, often described as sharp or stabbing, is a telltale sign something might be amiss. It's not the usual discomfort associated with pregnancy, but an intense, persistent pain that simply doesn't let up. Next on the list is vaginal bleeding. While some spotting or light bleeding can be normal during pregnancy, heavy bleeding is a red flag and might indicate abruptio placenta. It's important to note, however, that in some cases, bleeding may not be visible externally as the blood may be trapped behind the placenta. Rapid contractions, another key symptom, are also cause for concern. These are not your typical Braxton Hicks or practice contractions. They're stronger, more frequent, and can occur without any discernible pattern, often leading to premature labor. Now, let's touch on the potential complications abruptio placenta can cause for both mother and baby. For the mother, the most significant risk is hemorrhaging, which can lead to shock or even organ failure if not promptly addressed. There's also the risk of blood clotting disorders and, in severe cases, a life-threatening condition called disseminated intravascular coagulation. For the baby, the complications largely hinge on how much of the placenta separates. If a large portion detaches, it can lead to reduced oxygen and nutrient supply, resulting in low birth weight, premature birth, or in worst-case scenarios, stillbirth. Abruptio placenta is undeniably a serious condition, but it's vital to remember that with swift action and proper medical care, most mothers and babies come through just fine. So if you ever encounter these symptoms, seek immediate medical attention. Knowledge is power, and being aware of these key points can make all the difference. Now, how do doctors diagnose and treat this condition? Let's find out. Abruptio placenta, a serious pregnancy complication, is diagnosed through a combination of symptoms, ultrasounds, and blood tests. But first, it's crucial to understand that every pregnancy is unique, and a diagnosis is often a process of elimination based on the mother's history and presenting symptoms. When a pregnant woman presents with sudden abdominal pain, vaginal bleeding, or back pain, doctors may suspect abruptio placenta. The severity of these symptoms can vary widely, from mild discomfort to severe pain. But let's remember, these symptoms could also indicate other complications, so a definite diagnosis requires further investigation. Ultrasounds, a common tool in prenatal care, can be used to visualize the placenta and check for signs of detachment. However, it's important to note that ultrasounds might not always detect the condition, especially in cases of concealed abruption, where the bleeding is trapped between the placenta and the uterus. Blood tests also play a crucial role in diagnosis. An unusual level of fetal fibronectin, a protein that acts as a glue between the placenta and the uterus, can indicate that something is amiss. Complete blood count tests can help assess if the mother is anemic or if her clotting factors are out of balance, both of which could suggest abruptio placenta. Once diagnosed, the treatment options for abruptio placenta are determined by the severity of the condition and the stage of pregnancy. Mild cases may require bed rest, regular monitoring, and a wait-and-see approach. In more severe cases, hospitalization and potentially an emergency delivery might be necessary to protect the health of the mother and the baby. If the baby is near term, an immediate delivery may be the best course of action. Treatment decisions are made with the well-being of both the mother and the baby in mind. It's a delicate balance, ensuring the baby has enough time to develop, while also preventing further complications for the mother. In the end, the ultimate goal is to ensure the safety of both mother and baby. We've discussed the scary parts, but what about prevention? Can we reduce the risk of abruptio placenta? Indeed, prevention and risk reduction play a fundamental role in managing the potential occurrence of abruptio placenta. While some factors are beyond our control, certain lifestyle modifications can significantly lower the risk. The first strategy centers around maintaining a healthy lifestyle. This includes a balanced diet rich in essential nutrients and vitamins, regular physical activity, and adequate hydration. These elements together promote a healthy body and a conducive environment for pregnancy. Smoking is a significant risk factor for various health complications, including abruptio placenta. It constricts the blood vessels, including those in the placenta, leading to a heightened risk of premature placental detachment. Therefore, quitting smoking is a crucial step towards reducing the risk of this condition. Similarly, substance abuse, including alcohol and illicit drugs, can have detrimental effects on the health of both the mother and the baby. They can lead to complications such as abruptio placenta, amongst others. If you're struggling with addiction, seeking help is not only commendable, but also vital for your health and the health of your unborn child. Regular prenatal care is another preventive measure that cannot be overstated. Regular visits to your healthcare provider ensure that any potential issues are identified and addressed early. These visits also provide an opportunity to monitor the health of the mother and the baby, ensuring any changes or complications are promptly dealt with. Moreover, managing chronic conditions such as hypertension and diabetes, which can increase the risk of abruptio placenta, is essential. Regular checkups, medication, and lifestyle adjustments can help control these conditions and thus reduce the risk. In the end, the goal is to create the safest possible environment for your pregnancy. While we can't eliminate all risks, these steps can certainly help mitigate them. Your health and the health of your unborn child are worth every effort. Remember, prevention is always better than cure. To wrap things up, let's hear some real-life stories. Imagine being a first-time mom, excited to welcome your little one into the world, but then you experience severe abdominal pain and bleeding. This is what happened to Lisa. Her diagnosis? Abruptio placenta. She was rushed to the hospital, and thanks to the quick actions of her healthcare team, her baby was delivered safely via emergency C-section. Today, Lisa and her child are healthy and thriving, and she makes it a point to share her story to raise awareness about this condition. Then there's Maya, a mother of 2 who had had normal pregnancies before. But during her 3rd pregnancy, she noticed something was off. She felt discomfort, and her baby wasn't moving as much. She immediately sought medical attention and was diagnosed with abruptio placenta. She underwent an emergency C-section, and although her baby needed to stay in the NICU for a few weeks, both mother and child are doing well today. Next, we have Sophia, an older mom who was pregnant with her 5th child. She had never heard of abruptio placenta until she experienced it. She woke up in the middle of the night with severe back pain and knew something wasn't right. She got to the hospital just in time for the medical team to act swiftly. Her baby was delivered, and though he spent some time in the NICU, he's now a healthy, playful toddler. These stories are just a few examples of the many women who have experienced abruptio placenta. Each of them acted quickly, sought medical attention, and had healthcare teams who knew exactly what to do. They are a testament to the importance of awareness and swift action in dealing with this condition. Their experiences remind us that abruptio placenta can happen to anyone, regardless of how many times they've been pregnant or how healthy their previous pregnancies were. It also underlines the critical role healthcare professionals play in diagnosing and treating this condition promptly to ensure the best possible outcome for both mother and baby. And so, as we conclude our discussion on abruptio placenta, let's remember the importance of awareness. If you're pregnant or planning to be, know the signs. And if something doesn't feel right, don't hesitate to seek medical help. And that's a wrap on abruptio placenta. Stay aware, stay healthy.